Hello, I'm Rick Steiner with Steiner Event Group. Welcome to another episode of Lex Life Discovered. My co-host is Shannon Richmond with the Panama City Beach Chamber of Commerce. Shannon, you ready for another great episode?
Oh, yeah. No pressure here, but we've had some great different podcasts lately,
Yeah.
some guests, so no pressure.
Our guest today is Dr. Robert Howard, and he is a great physician, but he's a great person, good friend, and he also has a new company that he's started in Kentucky and Nashville as well, I think, called Optimize You.
Oh.
So, Robert, welcome to the podcast.
Hey, thank you. Great to be here with you guys.
Well, good. So, gosh,
Let's dive right in.
I know. Where do you want to start, Shannon?
I want to start with the cryo.
Okay. Do you want to start there, or do you want to tell us about Optimize You and start there
sure.
and then cover all of that?
Yeah, I'll kind of tell you a little bit about our company. So, we are a unique type of wellness clinic, and we are our Murray Clinic is one of 13 clinics around the country. We specialize in hormone optimization. We also provide athletic recovery services, peptide therapy, weight loss programs, and even programs to help people with their sexual health.
Okay. So when someone wants to come in and work with your company, what steps do they need to do?
Okay.
Like
to come in as a client?
Yes, I'm sorry.
Okay. Yeah. So usually people come in and what they usually are reporting symptoms of such as just not feeling like their normal selves, and maybe they notice a change over the past 5 years or so, and they feel like something is off. And of course, as we age, we notice that we really don't have the vitality and youth that we used to have. Increasingly, people want to recapture that and begin to feel more youthful. And so we start looking at hormones. We know that hormones are really vital to so many different organ systems as far as your metabolism goes, your sex drive goes, your moods, your sleep, your bone strength, your muscle strength. So it is vital to so many aspects in our lives. And so what we do, and I'll have to say our motto is normal is not optimal. So many people come to us feeling as though something's off. Maybe they can't put their finger on it, but they notice that maybe they're gaining weight, their sex drive isn't what it used to be, and they want to make that better. So often when people have their lab work done, they might be in the low normal range on certain values, and they're often told by their primary practitioners that everything looks fine, you're good to go. So what we do is we take a look at those labs. Of course, we have people come in, do their lab work, and we sit down with them and we hear what's going on, and we try to remedy those symptoms, those issues that they're having in their life. And we look at those labs and figure out how we can optimize those. So we replenish and replace hormones that have been lost over time and help people feel better. So we're basically in the business of treating hormone deficiencies and helping people feel better. So people come in for their lab work, and there's no commitment really to anything else other than just getting your blood work done. And after that, we'll sit down with the patient and go over with them their labs, come up with a curated plan that's really custom to them. And that might be improving their testosterone levels, for example, or it might be progesterone or estradiol in women. Women can actually take testosterone too, and it's actually they get the same benefits as men. So we sit down with them and we come up with a plan. And the way we work is sort of a concierge style practice. We have a really fun and relaxed environment. It's kind of unusual as compared to other medical clinics you might go to. We want people to come in and enjoy being here and participate in some of our recovery services as well, such as the cryotherapy, the infrared sauna, or even compression therapy.
You want to ask about the cryotherapy?
Yeah, so the
Shannon, I know this is
cryotherapy-
what Shannon wants to really find out about. So.
Okay.
Well, I know it gets really
Okay.
cold, and I'm just wondering how cold it
Yeah.
gets and how long you can stay in, and don't you want to run out of it because it's so cold?
Right. So
Do you lock us in?
It's stepping into. We don't lock you in
Okay.
there. It is in fact very cold. It can get all the way down to 190 below. and so it's very cold. So it's the temperature can fluctuate a little bit depending on the type of cryo chamber, but it's very cold. And what as far as staying in there, you stay in there for about 3 minutes. So we usually say, put your headphones on, listen to your favorite song. By the time it's over, it's time to get out. And what it has to do is really sort of the cool, dry air that you're experiencing, as opposed to getting in a cold bath or something like that. So it's the cool, dry air that causes vasoconstriction of your blood vessels, and that pulls blood away from your peripheral tissues into your core body. It's important to know it doesn't drop your core body temperature, though.
Oh, that's what I
The
was
cold,
thinking. I was
Really?
going to be freezing.
Yeah.
yeah.
Okay.
So you can actually check your temperature before and after you get out, and it's pretty remarkable.
That's
But it
So
doesn't
interesting.
drop
didn't you
your
think
Yeah.
you were
core
going to be
body
freezing?
temperature.
Yeah. It just seems like
Yeah.
you would. Yeah.
Yeah.
So it's very cold, but most people will come out of it and say, "Well, I thought it would be a lot colder or more uncomfortable." So it's that nice sort of dry air that people experience in there. So as opposed to getting in the ice bath, for example, it's much more comfortable for people, and also they get the benefits of it's whole body cryotherapy. So some places may have it just kind of all the way up to the neck or so forth, but this is whole body cryotherapy. And some neat things about it are there's some great research on it as well. As far as boosting your immune system, we know that it's been shown to reduce the number of colds, for example, that one has in a year. There's some interesting data on treating migraines with it. We know that it helps to speed up your metabolism. I think people also like the fat loss benefits from it, as far as getting rid of cellulite. But reducing inflammation is the key one, also, that I think people really enjoy from that experience.
So how often can people go into that and have that kind of therapy?
So you can use it pretty much as often as you want. Usually not more than once a day, but you can use it really as much as you want. We have people that come in maybe 2 to 3 times a week or so for it. Some people that come in once a week, and it really just kind of varies. There's really no limit, I guess you could say. We have the infrared sauna as well. So the only thing we ask is that you don't get in the sauna and then get into cryotherapy, because you're going to be
Oh,
hot and sweaty, and then probably having icicles coming off of you by the time you get out the cryotherapy machine.
oh. So number one is that you see people going to have that service is the boost of the immune system.
I would say reducing inflammation is probably
Okay.
one of the best things. So a lot of our athletes really like it, as far as boosting their recovery time, reducing inflammation. If they have tightness in their joints, for example, that's one good recovery mechanism for it. Um, and kind of reducing aches and pains, I guess you could say, as well.
So do you
So a lot
find
of our
that
athletes like it.
that's what I was just
Sorry, go
wondering
ahead.
about your athletes, like how many, like this is, it's not portable, so they have to go to you because I was thinking you'd be perfect for a marathon. Put one of those out there, and after they run the
Hmm.
marathon, let them, I don't know, but
Yeah, that
so
would be pretty cool.
you help a lot of the athletes with their aches and pains
Correct.
because it takes the inflammation out. How
Right.
smart is
It
that?
just, yeah.
Wow.
Amazing.
Yeah, and they also say it aids in recovery, decreases cramping, increases their performance. So it's just a good recovery tool for them.
All
I
right.
like
Then
that.
what are the advantages of the infrared sauna?
So infrared sauna, as opposed to getting in a traditional sauna that just has dry heat, we have deep penetrating infrared light. And what that does is to help increase blood flow to your muscles. And so this is a great recovery tool, let's say, for someone that just completed a workout, keeps those muscles nice and hot, increases blood flow to those tissues.
Okay. Well, great.
And what did you say about people that had a heart attack? You don't want that, not for the cryo spas, not for them.
Not for cryotherapy, just because it does cause vasoconstriction, and that's if someone's had, and we don't recommend it in pregnancy either, just because I don't think
Okay.
we have good data on that in pregnancy. But just from the vasoconstriction, if someone's had a heart attack, we advise them not to use that.
So is this a new thing? Is this the new wave, the cryo?
They're pretty. It's becoming pretty popular, so it's been around for a little while. Optimize You has really emphasized this as a great recovery method. So it's pretty popular. There are some other freestanding cryotherapy businesses that are out there. Um, None really in our immediate area. So it's an interesting draw to the clinic. We have a lot of people that come in and enjoy using it.
Well, the other part you mentioned is full body, because most of what I've seen, goes to the neck. So that's
Correct. This
interesting. I
is
assume
full
this,
body.
but this
Hmm.
one isn't. So what's the
Hmm.
advantage of one over the other?
Well, I just think you've got more surface area of your skin to work with. So, and you get a greater effect from it.
Okay, interesting.
Well, I want to try it.
Hmm.
And
Have you
then
tried it yet?
Yeah.
I haven't yet. I know
Oh,
I have to go out and do all
yeah.
this. So
Yeah.
yeah. And then
We
the
want to
other,
stay young.
that's true, yes. Well, Robert, he's looking younger
I
every time. So
know.
yeah. So,
Oh.
and then the compression. Uh,
Okay.
tell us about that as well.
Compression therapy.
Yeah.
Okay, yeah. So compression therapy is a great way to increase blood flow and nutrients to certain parts of the body. Perfect example of that is our leg compression therapy. People come in, we've got comfortable recliner type seats. You put these compression boots on your legs, for example, and it uses pneumatic pressure to increase blood flow to certain parts of the body. So this is something that's great post workout. Let's say somebody that's just gone for a run or someone that's just had done leg day at the gym. It's a great recovery tool for them.
Okay.
I love
Well,
all
good.
these little neat things that we can
Yeah,
do to feel
Yeah.
better and
Yeah.
look better.
yeah.
True. Yeah. So a lot of times, over the years, we've always heard about women's health and, all the great strides that are being made in that area. But it's honestly rewarding to see. I mean, that's good. Don't get me wrong. But it's also rewarding to see the focus on men's health becoming more open
Yep.
and discussed more. And you're kind of
Hmm.
leading
Hmm.
a leading factor in that for our area for sure, because you know guys just don't do this. I mean, talk about stuff, and deal
Hmm.
with it like women do as easily. So I
Oh,
I
that
Hmm.
was a
applaud you.
gentle way.
Huh?
That was a gentle way of saying that.
Well, I mean, no, women do better
Oh,
about
yeah, taking
discussing,
care
and
of
yeah,
ourselves.
yeah.
Yep.
And in fact,
Hmm.
isn't I saw something on one of your posts, and tell me if I'm wrong. Was there a like not trade show, but something in Nashville for men's healthcare recently? Were you there for
Oh,
something?
that I was there. That was the Nashville Men's Showcase, and that wasn't specifically for Men's Health. We were exhibitor there, but that was an event that was highlighting different businesses in the Nashville
Okay, okay,
area
yeah.
that had traditionally marketed male stuff, whether that be craft beer, bourbon,
Well,
Oh.
that's all part
cigars,
of it. That's
cars.
been our main
You know,
healthcare
so
before.
yeah,
Is that yeah?
so
So
yeah. So, we had a men's health, or we had the optimized booth there as a way to kind of help promote attention to men's health. So,
okay,
men's health is something I'm definitely passionate about. Men men tend, in a lot of ways, to sort of suffer quietly, and you see that, and I see that in my psychiatry practice and my addiction practice. Men are less likely to seek mental health care, for example, or treatment for addiction services. And I think the same is true for when it comes to treating sexual health issues or treating even testosterone and or hormone deficiencies. So, men, sometimes we get in our own way, and perhaps it's a sense of bravado, or feeling like they don't need treatment. I don't know exactly what that is, but I think helping men realize that it's okay to speak up about mental health
Mhm.
issues. If you're not feeling good, if you're gaining weight, having low sex drive, energy is not what it is. Come get your hormone levels checked. I think some men, unfortunately, see that as perhaps an insult to manhood
Yeah.
if
right.
they have low testosterone levels. And the unfortunate thing is, these hormones are naturally occurring in your body, and they form a foundation for your physical health and your mental health. And over time, those hormones are depleted. So what we're doing is just we're replacing those hormones. They're bioidentical hormones. So it is literally the most natural thing you could put in your body. Kind of interestingly, we live in I think a world where, people want only natural things, and you see these. You can't watch a sporting event without there being a commercial interrupting about some type of testosterone booster, and you've got images of some guy that's just ripped, and take these supplements, you're going to boost your testosterone. And I kind of laugh at that because it's quite obviously false advertising, and those products will do very little, if anything, to boost your testosterone. So what I like to tell guys, come get your hormone levels checked, and if you could benefit from testosterone replacement therapy, it's probably one of the best things you could do. It's certainly the best way to raise your testosterone because you're actually adding bioidentical hormone back into your system.
So how do you take, is it a pill, a shot, and what is it when you replace the
Yeah,
hormones?
that's a great question. So, okay, so for men, testosterone, we either offer injections or we offer creams. So I would say most of our guys opt for the injection. So it's a really small injection that most people take typically twice a week. And we do things a little bit differently than some, I think, of the older hormone clinics, but we promote sub-Q injections. Let me see if I can find the. So people kind of they hear injections and I think that kind of scares them sometimes,
Uh-huh.
but it's really just a very small insulin needle. So, and then what we do is we promote sub-Q injections. So it actually goes into your fat. And so we encourage people to pull up a little bit of love handle fat, and that's where it's the medication's injected. And we know that that route of delivery has better effects on your cholesterol
I
and
was just
decreases
doing this.
risk
I
of
was just showing that
pain
I
and
have plenty of fat to inject.
oh
So
yeah.
yeah.
So yeah.
So-
So you kind of want to do it on your side and your love handle. So we also offer creams, and this is a lipoderm cream. It sounds probably kind of strange, but it is applied to the scrotum, and we tell everyone it has to be applied to clean, dry, shaven scrotum, and that is applied typically every day, and once or twice a day, kind of depending on someone's dose. There are pros and cons to both. They both can get your levels certainly at an optimal level. Uh, some people just might kind of prefer one or the other, uh, but uh, you know, twice a week versus something you have to apply every day. With the creams, there's a potential risk for transference. So if you could potentially transfer some hormones to your partner, so we kind of want to be careful about anybody that may have a partner that is pregnant. You don't want to do the
Oh,
creams in that way because you don't want to transfer hormones to your partner.
so
So there are different reasons that or different ways in which we approach it.
so if you do them twice a week, do you come to you to do them, or do you let them take that home to do them?
Okay, we let them take it home, so their
Okay.
medications come to them in the mail. So
Oh,
it's very private. It kind of avoid
well,
the local
that's
pharmacy. So
nice.
small towns, I think people appreciate that. So
Absolutely.
it comes to you discreetly in the mail, and we educate our clients on how to do that. We have occasionally someone that is uncomfortable with it at first, and we invite them to come back into the clinic, and we show them how to administer it. But most people are able to do it on their own without any problem, and it's really painless. And once they get the hang of it, there's really nothing to it.
So once you start the hormone therapy, how long before you start to see or feel results?
Yeah, good question. So a lot of times people once they start hormones, they want to feel great the next day. It's the fact is it's a process. It does take some time, and for many people that might take the form of a few months. We do like to encourage people to continue the therapy for several months, and most people continue the therapy indefinitely because they feel so good on it that they want to continue it. You
Absolutely.
see benefits over time. Of course, things that it helps with are your mood, your energy, your sex drive, improves your sleep, and as well as your bone strength and muscle strength. So um, it can help with fat loss, which is one of the great things about it, and that has tremendous benefits as far as decreasing one's insulin resistance, obesity, chances for heart disease, stroke. So, and testosterone is one of a few medications that's actually been shown to prolong life expectancy. So it's really a great thing, and I think as far as the benefits go, it may take a few months to see those.
Okay. And for women, what are the different choices that women can have besides they
Okay,
wouldn't
yeah.
do
So women,
they don't get to rub it? I don't know.
you know, uh,
And you went there.
all right, let me
So-
think. And you went there. Let me think on it for a sec. Okay. So there are, when it comes to treating men and women, so we look at a different groups of hormones. So we look at metabolism, whether that be thyroid hormone. We look at that in men and women. When it comes to testosterone, a lot of women can benefit from testosterone. Women get the same benefits as men: improve muscle strength, bone strength, and metabolism, increasing their moods and improving their sleep. So women get the same benefits from it. The route of delivery could be different. We have women that do testosterone injections, and there are that's probably the most common. Uh,
Hmm.
it kind of depends on what we're treating as far as women's hormones and what's going on. For example, if we have a female client with PCOS, which is a common condition seen in females, often we treat that with uh, thyroid and progesterone. So it just kind of depends on what's going on. And, also women, I think where women can really benefit from our program is in the perimenopausal phase. So this is the period where a woman is not yet fully menopausal. And if they have any symptoms at all, they're just kind of told that that's normal. So whether they're having hot flashes, trouble sleeping. I see you laughing there. Did I?
Well, let me just
uh,
say something here. I appreciate the fact you
okay.
said the route of delivery. That was so much more professional. Than
Yeah.
you know.
Oh yeah. Okay.
No.
All right. I was distracted by you chuckling. I was wondering what it was. So.
What were you laughing at?
So Paul, the producer over here, keeps trying to
Mhm.
feed me with questions that no.
Hey, you can ask me anything.
So
You can ask me.
so for women, are there shots for them? Are there pills for them? Cream, same thing as for men?
It just kind of depends on the hormone. Yes,
Okay.
testosterone you can get in different forms. A lot of the other hormones that we use are in pill form, whether that's thyroid, progesterone, or estradiol. So a big emphasis, or one of the things we really like to emphasize in treating women's hormones is, especially in the postmenopausal phase, where women are depleted from estrogen or estradiol, and with that you have osteoporosis. You have some changes um, intimately that I think are a lot of are unwanted or at least uncomfortable. So I think it's in the postmenopausal phase. Estradiol is a great option for improving enjoyment in life and overall health outcomes in life. When it comes to women's hormones, all hormones in general, I would say, are people don't really know what to think about it. Like, is that safe? Is that a good thing?
Mhm.
Is that a bad thing? And the hormones of yesteryear are the ones that sort of give hormone therapy a bad rap. For example, the hormones Premarin, Provera, we know that those hormones were harmful. Uh, but unfortunately, the studies uh, were done 20 years ago are sort of perpetuated today. And the key thing is that people really have to understand the difference between synthetic hormones and bioidentical hormones. So that we know that bioidentical hormones are safe. We know that the synthetic ones, there is an increased risk for, let's say, heart attack and stroke. So this may be way too much detail for
No,
you,
I
but
like it.
this kind of goes back to the WHI trial, which was a long time ago, and this was a very large trial that showed the studying hormone safety. And what they found in that trial, and this often gets cited in the news and so forth, was that uh, people who took hormones were more likely to have heart attacks and stroke, for example. And but what the people in that study already had significant risk factors such as
Oh.
diabetes, heart disease, and most people in the study lived. But now, so I think that so just kind of gets perpetuated over time. People think, well, this isn't safe. Now, we do know that the bioidentical hormones are safe. We still have to be cautious with some things, but we know that there is much improved safety profile over the drugs that are available today.
So
So go ahead.
for hormones, when's the optimal time that a man or a woman should start thinking about replacing their hormones or adding
Okay, or adding.
or
I
whatever
don't have a
whatever to,
good age to tell you about that. Yeah,
okay.
because everybody's different. And, for example, and some men have symptoms of low testosterone, fairly early. Maybe they're late 20s, 30s. I
Oh.
would say on average, most are 40s, 50s, 60s that look into that. In women, it's quite a bit different because you can have, kind of depending on whether they're premenopausal, if they are perimenopausal or postmenopausal, or if it's something else altogether. So it's hard to say specifically on the ages. So what I usually say, if people feel, if they're not feeling as good as they used to, if you look at over the past 5 years and think, my energy isn't what it used to be. My sex drive isn't what it used to be. I'm gaining weight, and no matter what I do, I can't get it off. Well, then it's probably worthwhile to come in, get your hormone levels checked, and we go from there.
Okay, and then going back to the synthetic
Hmm.
drugs. So it really that should be one of our first questions we ask a health provider. Is it synthetic? Because if it's
Hmm.
synthetic, then we don't want it, right? Or is that true?
Or
Well,
do they still offer synthetic?
I don't know. That's what
Oh.
yeah.
yes, I do occasionally hear of that.
Oh.
Uh, Premarin, for example, give you an example. It actually is derived from horse urine. This is a female hormone, estrogen derivative. So there are something like 40 other hormones that are present in horses that are not present in humans. You don't want to be taking those.
Really?
And so you really want the
Crazy.
bioidentical hormone, estradiol, instead of yeah, the synthetic estrogens. So, and then in men, the testosterone is bioidentical.
Interesting.
Wow, that
A
is
lot of
so
things to think
interesting.
Hmm.
about. Yeah.
Yeah,
So
yeah, yeah.
when you
And I
decide,
think
go ahead. Go ahead.
Go ahead. Okay. I was going to kind of a sidebar here, but I think that's really interesting is that especially when we look at testosterone levels, we know that globally testosterone levels are declining, and with that, sperm counts are declining. So we're seeing an increase in male infertility. I think it's something in the past 40 years. There's been a 60% reduction in testosterone, and there's lots of different theories as to why that is. So, why is it that men today have lower testosterone levels? And what we're increasingly looking at are what we call endocrine disruptors. So these are environmental chemicals that are pervasive throughout
Oh, you
our,
can't
our
help it. It's
societies.
in the
For example,
environment.
yeah, so plastics, for example, pesticides. These are things that are thought to interrupt our natural hormone production. So it's really very interesting that, in the past 40 years or so, we've seen a dramatic drop
Yeah.
in testosterone levels.
That's interesting.
All this is so
It
interesting.
Hmm.
is. It
I
is.
can listen for
Hmm.
hours. Keep
Yeah.
going.
Well,
I could probably
that's why I
talk for
wanted Robert
hours.
on because he's dealing with men's health issues, and
Yeah,
of course women
Yeah.
too. But still, it's getting that discussion started.
that's right.
When you opened your company and your Optimize You and Murray, obviously you knew it was going to do well, or you wouldn't have believed it, or you wouldn't have done it. How has the response been? Because that's kind of in a way, a forward-thinking company for that area.
Mm.
Hmm.
That makes
Hmm.
sense.
Absolutely. Well, it's been very well received. We've
Yeah.
had a lot of success off the bat. We've just been open 5 months
Oh,
and are very pleased with the number of people that have come in. Um, I think I think increasingly people are looking for something else to take control of their health, and I'm not sure if COVID's really played a role in this or not, but I do think it's affected how care is delivered and how patients receive care. I think, unfortunately, there's been a lot of mistrust in the medical community as it relates, as a result of COVID. And also, COVID was terrible for our mental health as well as our physical health. But I think increasingly people are wanting to take charge of their own health. And I think that's a great thing about our company is, people can come in and they can be very much involved with what, that their goals and what, tell us what, they want to see happen, whether that's losing weight, um, improving their sex drive, energy, so forth. So, a neat thing about our clinic is, again, being concierge membership style program, is that we do eliminate the insurance companies because unfortunately they really don't have the best interest of the patient at heart and often dictate what types of services can be provided and very much limits what types of services a patient can receive. So we love that. We've really restored what I think is the patient provider relationship and really put the patient back at the focus of the treatment plan, which is how it should be.
Yeah, he gives it
True.
back to us. We get the driver's
Hmm.
seat to kind
Right.
of, I love that.
Yeah.
Exactly,
I like that.
exactly.
Man, this has
That's the
been
best
And I
thing
think,
you've
interesting.
said all day.
well,
Thanks.
No, I'm just kidding.
thank you.
This has been so awesome. Yeah,
Yeah,
Well,
we got to have him back.
we will. We will. Oh, Robert, he's got great things ahead. There's no doubt. I mean, he's a sharp young man and such a great future in so many areas, and he's accomplished so much as it is. So,
Yeah.
but we thank you so
well,
much
thank
for being
you.
on with us today. So, give people your website again, your information to contact you, and let them
Sure.
know how to
Yeah.
do that.
So our website is optimizeyounow.com. My email is robert.howard@optimizeyounow.com. And, if there's anyone that's interested in joining our team, please reach out to me. Our clinics are constantly expanding, and we're hoping to open several new clinics this year. So, especially if there's any nurse practitioners or physician's assistants that want to be a part of an exciting team, don't hesitate to reach out.
We were thinking Panama City Beach would be a fantastic
I think
location.
I think it would be I think it'd be a great location and a good excuse to come down and see you guys.
That's
Well, there you
absolutely,
go. So
yeah.
we'll
Uh,
work that out then. All right. Well, thank you again. And that is another episode of Lux Life Discovered. We thank you for joining us today, and we will see you soon. Thanks.
Check out Lux Life Discovered on Facebook and Instagram and on 30a.tv. See you next time on Lux Life Discovered.